Take the right path, my health, my right. HIV and AIDS. Key facts everyone should know. Human Immunodeficiency Virus (HIV) is a virus that attacks the body's immune system. Acquired Immunodeficiency Syndrome, that is AIDS, occurs at the most advanced stage of infection. HIV targets the body's white blood cells, weakening the immune system. This makes it easier to get sick with diseases like tuberculosis, infection, and other cancers. HIV is spread from the body fluids of an infected person, including blood, breast milk, semen, and vaginal fluids. It is not spread by kissing, hugs, or sharing food. HIV can be prevented and treated with antiretroviral therapy. Untreated HIV can progress to AIDS, often after many years. WHO now defines advanced HIV disease, that is AHD, as CD4 cells count less than 200 cell mm3. All children younger than 5 years of age living with HIV are considered to have advanced HIV disease. Signs and symptoms. The symptom of HIV varies depending upon the stage of infection. Stage 1, acute HIV infection; 2, chronic HIV infection; stage 3, that is AIDS, acute immunodeficiency syndrome. HIV spread most easily in the early months after infection, but many people remain unaware of their status until later stages. In the first week, some may have no symptoms, while others might experience flu-like symptoms such as fever, fainting, headache, sore throat, swollen lymph gland, short-term nausea, muscular ache and pain, rash. Without treatment, people living with HIV infection can also develop severe illness like tuberculosis, cryptococcal meningitis, several bacterial infections, cancers such as lymphoma and Kaposi's sarcoma. HIV causes other infections to get worse, such as hepatitis C, hepatitis B, and mpox, that is monkeypox. HIV can be transmitted by the exchange of body fluids from people living with HIV, including blood, breast milk, semen, and vaginal secretion. HIV can also be transmitted to child during pregnancy and delivery. People cannot become infected with HIV through ordinary day-to-day contacts such as kissing, hugging, shaking hands, or sharing personal objects, food, or water. People living with HIV who are taking antiretroviral therapy and have an undetectable viral load will not transmit HIV to their sexual partners. Early access to antiretroviral therapy and support to remain on treatment is therefore critical not only to improve the health of people living with HIV, but also to prevent HIV transmission. Risk factor: having anal or vaginal sex without condom, having another sexually transmitted infection such as syphilis, herpes, chlamydia, gonorrhea, and bacterial vaginosis, harmful use of alcohol or drugs in the context of sexual behavior, sharing contaminated needles, syringe, and other injecting equipment, receiving unsafe injections, blood transfusion, or tissue transplantation, accidental needle stick injuries among health workers. Diagnosis: HIV can be diagnosed by nucleic acid test, antigen antibody test, and antibody test. And this antigen antibody test or antibody test are rapid test, and nucleic acid test will take time to get the result. Prevention: how to prevent? Use condoms. Get tested regularly. Take pre-exposure prophylaxis if you are at high risk. Avoid sharing needles. Safe medical practices. Prevent mother-to-child transmission. Limit sexual partners. Get treated for other sexually transmitted infection. Educations and awareness. Treatment: there is no cure for HIV infection. It is treated with antiretroviral drugs, which stop the virus from replicating in the body. Antiretroviral therapy (ART). do not cure HIV infection but allows a person's immune system to get stronger. This helps them to fight other infections. Antiretroviral therapy reduces the amount of HIV in the body, preventing symptoms and enabling individuals to live full, healthy lives. People living with HIV who are not effective antiretroviral therapy and have an undetectable viral load cannot transmit the virus to their sexual partners. Pregnant women with HIV should start antiretroviral therapy as early as possible to protect their health and reduce the risk of transmitting the virus to the baby during pregnancy, childbirth, or breastfeeding. There is growing hope for the future of HIV treatment and prevention with advances in long-acting therapies, innovative medications, and potential vaccines. These developments bring us closer to controlling the epidemic and improving the lives of people living with HIV worldwide.
Subscribe to Simply Micromed. If you're curious about medical microbiology, infectious diseases, and unraveling the mysteries of tiny organisms, hit that subscribe button. Join our community of science enthusiasts, and let's explore the microscopic world together. Remember, knowledge is contagious. Spread it by liking and subscribing. Thank you.